So one of the questions people ask is, Doc, when do I get my knee replaced, or when do I get my hip replaced? It's a very personal answer. It's different for everybody. What we tell them is that there are different treatment modalities that we use that aren't surgery. And you should try all of those to see if they'll give you some pain relief and keep you doing what you want to do. Eventually, they probably won't make you pain-free anymore, or they won't allow you to do the things that you want to do. And at that point, that's when you start talking about joint replacement surgery. It doesn't have anything to do with age. It doesn't necessarily have anything to do with the x-rays. Some of the folks that have the worst arthritis on the x-rays function very well without the surgery. So all of those factors come in, and then in the end it comes down to the patient's decision about whether or not they can tolerate the discomfort they're in and do the things they want to do. And if they can't, then we start talking about replacing their joints. Selecting a doctor is, once again, a pretty personal decision between people. There are certain patients that won't like certain physicians. I think that you should trust who is going to be your surgeon. You should feel comfortable with them, because it's a little like a marriage or relationship. Once we replace their joints, they pretty much belong to us for long periods of time. We'll see them periodically. We see follow-ups for joints years, even decades down the road, because there are little things that can go wrong with them, and you need to feel comfortable that the physician that you have is somebody that you can trust and somebody that you can come back to when you need something. Deciding where to have the surgery goes partly back to what we talked about earlier, which is, I've done this all over. We have been doing total joints at St. Mary's since the 1970s. We developed a joint program in 2008, which is in existence now. That's the joint program that we have. And the reason for that was to sort of make the process much more palatable for the patients. They know more about what to expect. When their expectations are met, they do better, their results improve, the cost of the procedure is down. So all the things that we look at to decide whether patients are doing well and whether the hospital's doing well and whether these joints are doing well are all improved by having these joint centers set up. We've had it since 2008. The rest of the country now is starting to develop these programs. Almost all the hospitals are beginning to have them. And what I tell people is, you don't have to drive all the way to Oklahoma City or Tulsa. You can have those procedures done here, and they're done, in most cases, as well or better than what you'd get in other places. Plus, your doctors, your nurses, they all live in the area that you're living as well. So you'll see them. I see my patients at the grocery store. I see them at the golf course. I see them all over. So you're sort of part of the community as well, which I think is a beneficial way to deal with these problems. So anybody that's thinking about having a joint replacement, almost all of them have talked to friends or family or other people that they know that have had joint replacements. Over the years, one of the biggest complaints has always been the amount of pain, or how much pain am I going to have. Since we have started this program in 2008, the pain levels have dropped down significantly. There's a lot of new technologies that we're using in the operating room, before surgery, during surgery, and after surgery to try to decrease the amount of pain that the patients have. So that level of pain has gone down significantly. Having said that, there is some pain associated with the procedure. The good news is that, once again, having done this a bunch, our staff is very knowledgeable. They're very good at taking care of the pain, and the goal is to try to keep the pain from getting to a level that you can't tolerate. So over the years, total joint replacement has changed dramatically. When we first started these programs back in 2008, and even before that, the length of stay for the hospital, the patients would come in and they'd spend sometimes up to a week in the hospital trying to get over the surgery. Today, we're sending the majority of our patients home one day after surgery. About 95% of them go home within 2 days. So the patients aren't having to stay in the hospital near as long as they used to. Most of that has to do with the fact that their pain is well controlled. The technologies of joint replacement in general have dramatically changed as well. The implants are better. The medications that we use during surgery are better. So there's less nausea, less vomiting, less pain, less blood loss. So all those things continue to improve. Having said that, total joint replacement really is not dramatically different from what it was back in the 1980s. It's still a plastic metal implant for total knees. The hips have changed a little bit. For the most part, though, they're relatively the same. And the reason for that is it's tried and true, and it works, and it continues to work. The results for these are excellent across the country, and so we continue to try to improve how our patients deal with this, how well they do with it, but in the end, joint replacement is a good procedure. Hip and knee replacement surgery is it's a big surgery. It's not a small in and out type thing normally, although the patient stays have gotten a lot less. So there are still some significant risks associated with it. Most of them are related to your overall health to begin with. So it's heart attacks, strokes, blood clots. Folks that are diabetic have increased risks. All of those things, most patients already know that they have. The risks pertinent just to the surgery, once again, are usually blood loss issues. There's problems sometimes with the implants where they may have some continued pain afterwards that lasts a little bit longer. The majority of those things get better over time. The pain improves. Some of them need a little more physical therapy to get through that pain, but eventually that gets better. But other than that, most of the complications are things that are known beforehand. The Joint Center, we spend a lot of time trying to figure out what those potential complications are, going through the program to make sure that we limit those as much as possible. In the end, there is some risk to the surgery, but we try to minimize that as well as we can. So after the patients have the surgery, they'll spend, like I said, about 1 day in the hospital overnight, sometimes 2 days, depending on how well they get up and get going, and once again, barring any complications. They'll be up and walking with a walker during that period of time. Early on, the nurses will assist them, the physical therapists will assist them, and will slowly progress them to where they can walk with the walker by themselves. They will then go home with the walker for a period of time, and their physical therapist, whether that's outpatient physical therapy or whether that's a home health type physical therapy, they will then progress off the walker to a cane, and then usually from a cane to unassisted. The amount of time that takes, once again, varies between patients. The healthier they are, the more active they are before they have their joint, the quicker they usually progress through those stages and then back to their normal activities. So recovery from a total joint replacement depends on a few things. Once again, the patient's status prior to the joint replacement is probably the biggest one. The type of joint, whether it's a hip or a knee, they vary as well. Normally what I tell folks is that within the first 2 weeks, they'll be doing most things at home by themselves without any aid except for a walker or a cane. They probably won't return to work duties for at least 6 to 8 weeks, and once again, depends on the job. But for the most part, they should be up and walking. They're going to physical therapy 3 times a week within 2 days of the surgery. So they're out and about doing the things they want to do. They just may have to limit those things for a period of time just because they're tired or sore. But that usually gets better. And once again, at 6 weeks, I usually expect them to be doing most things.